So, if you're watching this, there's a good chance you care about your health and you're trying to prevent serious problems down the road. So, stay with me because one common habit people think is protecting their heart may actually be putting them at risk. 2 days ago, someone asked me, should I start taking a daily aspirin? And I hear this question all the time. My name is Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician and founder of InTouch Primary Care in Sugarland. And over the years, I've seen many people take aspirin or consider starting it simply because they heard it was good for the heart. But here's the issue. Aspirin is over the counter, so it feels harmless, but whether it helps or harms you depends entirely on your personal risk, not general advice from years ago. And I'm going to explain this more and so that you can figure out who might benefit from aspirin because some people benefit from it, but it can also be harmful. I once cared for someone who suddenly passed out at home. Fortunately, she was rushed to the hospital in time and she was found to have internal bleeding. When we reviewed her history, we learned that she had been taking a daily aspirin, not because it was recommended for her, but because she heard it was good for preventing heart disease. But in her case, it actually hurt her, it didn't protect her. Unfortunately, this isn't rare. Studies have shown that low dose aspirin increases the risk of major bleeding by 40 to 60%, most often in the gut or in the brain. So I'm going to slowly break this down and kind of explain why this happens. Well, what aspirin does, it works by making your blood less likely to clot, which can be very helpful if you're at high risk of dangerous clots. So especially after a heart attack or a stroke, you could be at high risk of a clot. But that same effect can increase your risk of bleeding, especially in the stomach or in the brain. So aspirin is not a vitamin. It's not a general wellness pill. It's a medication and it has real risk. And newer evidence has shown that, doing a routine daily aspirin for most people who do not already have heart disease is not necessary. So, this is how you can think about it in very simple terms. You can ask yourself these questions. Number one, are you between the ages of 40 to 59? So if you're under 40, aspirin is almost never recommended for prevention. May be recommended for treatment, but not for prevention under 40. If you're between 40 and 59, aspirin might be considered, but only if your heart risk is truly high. So if your cardiovascular risk is high and you're between 40 and 59, aspirin might be considered. If you're 60 or older, starting aspirin for prevention is usually not recommended for prevention, right? Because bleeding risk outweighs benefit the older you get. Okay, so first question, are you between ages 40 and 59? Second question, do you already have heart disease or a history of stroke? So if yes, meaning you've had a heart attack, you've had a stroke, or you've had certain heart procedures, aspirin may be appropriate. So if you've had a history of a heart attack, a stroke, or certain heart procedures, maybe. If no, the benefit of prevention is much less clear. Third question, do you have a low risk of bleeding, meaning you've never had a history of stomach ulcers or GI bleeding, you do not easily bruise or bleed, you don't have anemia, you're not on any blood thinners or steroids, you don't have a history of fainting or unexplained bleeding. If these are true, you do not have any history of bleeding, a high risk of bleeding, then maybe you may be able to take an aspirin. If no, if the bleeding risk is high, then aspirin is usually not recommended. So you can ask yourself these three questions. How old are you? Are you between the ages of 40 or 49? Yes or no? If yes, maybe. Have you had a heart disease, a history of heart disease or a history of stroke? If yes, maybe you can take aspirin. Do you have a low risk of bleeding? no history of stomach ulcers, easily bleeding, anemia, blood thinners. If all this is true, then maybe you can talk to your doctor about aspirin. If you answered no across the board, then it's unlikely that a daily aspirin is helping you. And the problem is it can actually cause harm. So the bottom line is aspirin should never be a self-decision. If you're a certain age or you have known heart disease and low bleeding risk, it may be appropriate. But for most people without heart disease, the benefit simply is not there. Aspirin can save lives in the right person, but in the wrong person, or in some cases, not the wrong person, but in some cases, it can actually cause serious harm. So really important that that decision is not made lightly. But if you're asking this question at all, it's a good question, and it's because you really care about preventing heart disease. And that really does matter. Heart disease is the number one killer worldwide. So it's important to consider it. But real prevention doesn't start by grabbing a pill. True prevention is actually strategic. It's about lowering your overall risk, not just for heart disease, but for cancers and many other serious conditions. And really, there is a way to do that. It starts with the basics, checking your vital signs, even when you feel fine, making sure you keep up with your annual physicals, checking your labs, even when you feel fine. Honestly, looking at your lifestyle, your past and present habits, looking at that and confirming that it is in line with your health goals, understanding your family history, doing a careful review of your medications and your allergies. And then when you put all that together, you can understand your true risk, and then you can create a plan to lower it safely. So there is a way to truly prevent your risk for serious health conditions. And there's a way that it can be done systematically, it can be done strategically with the right guidance. Prevention should never be guesswork. And most heart disease risk actually comes from a few common conditions: high blood pressure, diabetes, high cholesterol. And the good news is these are often the most preventable and treatable conditions we see. So for most people, the biggest reduction in heart disease doesn't come from aspirin. It comes from learning how to manage blood pressure, learning to keep their blood sugar within normal limits, and learning how to keep their cholesterol within normal limits. And if you want to learn more about this, you can check out the next video, Natural Ways to Lower Your Blood Pressure, ways that actually work. So when you lower your blood pressure safely, you're already doing far more for your heart than a daily aspirin ever could in terms of prevention. So doing prevention this way does take time. You have to look at your numbers, you have to look at your habits, your goals, and build a plan that actually fits your life. But that's how prevention really works. So if you're in Texas and you want help understanding your personal risk, you can schedule a free 15-minute consult with us here at InTouch Primary Care, and we can share more about how our services work and how we may be able to help you. And if this was helpful, go ahead and like this video, go ahead and subscribe, share it with someone who's trying to take better care of their health, because it can truly make a difference for them. Caring about prevention is powerful, but it's important that it's done in the right way, in the way that truly protects you, not just something that feels proactive. So I hope that helps.